Have you ever pondered about the intricate workings of the human mind, especially in terms of sexual deviation and paranoia? Today, we embark on a journey to understand these two distinct psychological conditions as defined by the DSM-5. Sexual deviation or paraphilia refers to atypical sexual interests, while paranoia is a thought process believed to be heavily influenced by fear or anxiety. Though different, both affect human behavior and experiences in remarkable ways. Stay tuned as we delve deeper into these two psychological phenomena. At first glance, sexual deviation and paranoia might seem like two dissimilar conditions. But do they have any common ground? Indeed, they do. Both conditions can cause significant distress to the individual. They may feel isolated, misunderstood, and struggle with self-esteem. This distress can permeate all aspects of life, from relationships to work, hindering daily functioning. Moreover, both sexual deviation and paranoia are often misunderstood by society. Stigmas and misconceptions abound, leading to further isolation and distress for the individuals dealing with these conditions. Another key similarity lies in the need for professional diagnosis and treatment. Self-diagnosis, or attempting to manage these conditions without professional help, can lead to complications and worsening of symptoms. So even though sexual deviation and paranoia may appear vastly different on the surface, they share some profound similarities. However, it's crucial to remember that while they share some commonalities, sexual deviation and paranoia are fundamentally different conditions. Now let's pull back the layers to reveal how sexual deviation and paranoia diverge in their symptoms and effects. The fundamental differences between sexual deviation and paranoia are quite stark. Sexual deviation, also known as paraphilic disorder, is characterized by unusual or abnormal sexual desires or behaviors. These desires or behaviors can cause distress or impairment to the individual or involve harm or risk of harm to others. It's important to note that not all unusual sexual interests lead to distress or are harmful, and thus are not considered disorders in themselves. On the other hand, paranoia, often seen in paranoid personality disorder or schizophrenia, is characterized by irrational suspicion and mistrust of others. Individuals with paranoia often feel persecuted, harboring beliefs that others are out to harm them. This constant state of alert can lead to dysfunctional relationships and difficulties in social and professional settings. Now, let's talk about treatment and management. For sexual deviation, this often involves behavioral therapy, medication, or a combination of both, aimed at managing the distressing symptoms and preventing any harm. Paranoia, however, is typically treated with psychotherapy, specifically cognitive behavioral therapy, to help individuals challenge their irrational beliefs and develop healthier ways of thinking. So while both conditions may significantly impact an individual's life, the nature of these impacts and the approach to treatment are quite distinct. As you can see, sexual deviation and paranoia are unique in their own ways, each presenting its own set of challenges. Clearly, the human mind continues to be a fascinating subject of study. We've delved into the complexities of sexual deviation and paranoia, two conditions that, despite their differences, share common ground. Both are products of intricate psychological processes and can significantly impact an individual's life. In terms of similarities, we've seen how both conditions can result from heightened anxiety or stress, and how they can lead to isolation or estrangement. Yet they diverge in their manifestation and societal perception. Paranoia is commonly associated with excessive fear or suspicion, while sexual deviation often involves sexual behavior or interests that deviate from societal norms. Understanding these conditions is crucial, not just for academic enrichment, but to foster empathy and understanding in our society. By comprehending the complexities of these mental conditions, we can better relate to, support, and advocate for those affected. Remember, knowledge is power. The more we understand about these conditions, the better we can support those who are affected by them.